So next we got her on a treadmill and we did a running analysis. Okay. So the first thing I noticed is that she's a 4-foot runner. So she actively tries to touch the ground with each stride with the front of her foot. Right. And she's done this for the past 15 or so years, for as long as she can kind of remember with her running. And it's something that she naturally did. We do know that if you're adopting more of a 4-foot strike as compared to a rear foot strike, that does increase stress on the Achilles tendon. So something that just perked my interest. What I will say is that we didn't end up changing her foot strike pattern because we didn't find that we needed to over the course of time. And I want you to keep this in mind as a physical therapist, because when you have a patient that runs on the treadmill and you notice something that's maybe related to their pain, doesn't mean right away that you have to change their running pattern. Because when you start doing that, you may end up stressing other structures that don't have the capacity or low tolerance, right? You may cause more problems than fix problems, right? Keep that in mind. The other thing I noticed that she's very bouncy. She's a lot of vertical displacement, and that might end up putting a little bit more stress through that Achilles tendon. Okay. What was also interesting is watching her watching her run and then looking at the hips. She didn't have that same hip drop that I noticed in the lunge, right? In the single-legged squat. So what's interesting is that we don't have that same carryover. As a physical therapist, you see that in a single leg squat, you might think automatically, wow, that hip drop is going to be contributing to the problems during your running. But when we get on the treadmill, I didn't see that. Okay. So I didn't feel the need to address that because the most important thing that she can't handle right now is running. And she's not having issues during running. Did I cue her up a little bit when we're doing lunges and squats in the gym? Yes. And she was able to change that issue pretty quickly. However, I didn't see that with her running. Okay. Next thing I'd like to take a look at is cadence. So we use the Run Cadence app developed by Chris Johnson. Basically, you open the app, turn it on, 3, 2, 1, go. You run for 60 seconds with your phone in your hand, and it tells you your cadence. And I asked my patient to run at your normal training speed. Okay. And what we found is that her cadence was around 160. Okay. And generally speaking, that's a bit on the low end. What were we basing that off of? Generally speaking, most elite runners are going to be at least 180 steps per minute, pretty much at all race speeds. So marathon all the way down to like 100-meter dash, they're going to be 180 or more. Okay. And this is probably not optimal for all speeds, but suffice to say, a slower cadence is going to increase stress on the Achilles tendon. So we can increase the cadence and reduce stress on the Achilles tendon. And that's actually what we ended up doing. Okay. Going back to this idea of altering technique, I didn't change technique too much, but when you alter cadence, you're probably adopting more of a midfoot strike over a 4-foot strike. You're changing step length. And through those variables, we're probably decreasing a little stress on the Achilles tendon. At the end of the day, I want my patients to be running as soon as possible while respecting the injured area and allowing them to get better over the course of time. All right. So in my mind, I'm thinking, can we change the running technique up a little bit or some of these variables from a program perspective in a way that allows her to continue training? Because that's the best case scenario. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain-Free Mini Course. Definitely check this out.